Good morning, everyone. Welcome to today's Pediatric Grand Round. So today's session is in recognition of Asian, Native Hawaiian, and Pacific Islander Heritage Month. And we're so excited to have our own Joyce Javier back with us to talk about giving back to the community that raised me, bringing visibility to mental health inequities among Filipino youth. On the next slide, we have 3 exciting sessions coming up. Lucille Packard Hospital Pediatric Patient Safety Lecture, Learning from Every Opportunity, Strategies and Challenges. We'll have Daniel Hyman from Children's Hospital Philadelphia. On May 27th, we'll have Ray Bignall, Associate Chief Diversity and Health Equity Officer from Nationwide Children's, coming to us to tell us about what Kids and Kidneys can teach us about racism in the Bay Area. And then on June 3rd, we'll have another alumni coming back with us for the 5th Annual Diversity and Inclusion Forum, Debika Bouchan, Acting California Surgeon General. We'd like to remind everyone about the Asian American, Native Hawaiian, and Pacific Islander Birth Equity Conference coming up on May 16th from 10 to 3. It's online and in person at the Arriaga Center at Stanford. And you can register by clicking this QR code. It's hosted by the CPQCC, Stanford Medicine Care, UCSF, and the CMQCC. And then we'd also like to remind everyone that we have our 5th Annual Diversity and Inclusion Forum, which is the conclusion of this year's lead. And we'd like to invite everyone to register today. It's on Friday, June 3rd from 8 to 3. And it starts with our keynote speaker, Dr. Debika Bouchan. And then we'd like to remind everyone to please nominate a colleague for our annual Pediatrics Faculty and Staff Awards. And Awards Day takes place on June 24th at 8 in the LPCH auditorium. You can scan the QR code here to nominate a colleague, but nominations are due by May 31, 2022. So please nominate a colleague. So Dr. Javier has received several awards for her work. She's gotten the Local Hero Award from the AAP Council on Pediatrics, the Filipino Women's Network Award for the 100 Most Influential Filipino Women in the World Award, and the 2021 Robert Wood Johnson Award for Health Equity presented by the American Public Health Association's Asian Pacific Islander Caucus for Public Health. And she was so humbled to join us here for Pediatric Grand Rounds. So I just wanted to honor you and all of your achievements. And so with that, I'll turn it over to Dr. Javier.
All right, so thank you and for the very warm welcome and happy Asian American, Native Hawaiian, Pacific Islander Heritage Month. I wanted to start by saying I have no conflicts of interest to disclose. I do want to acknowledge the land on which I'm gathered with you here today in Los Angeles is the home of and traditional land belonging to the Tongva Nation. I also want to share how excited I am to come home virtually to the farm and Packard, the place where I became a pediatrician, a physician scientist, and a mother. Here's our intern photo from 2001, which was actually a few months prior to 9/11. I also want to acknowledge that all communities of color, including Black, Indigenous, Latinos, face health disparities because of numerous health injustices. In this presentation, I plan to give you a glimpse of the Filipino community, an often invisible community that I belong to that has had a strong foothold here in the Bay Area and California. And although everyone in the audience may be coming from different backgrounds, I would argue that what perhaps ties us all together is that the majority of you have been served or perhaps supported by a Filipina nurse, either in your training, your current clinical practice, or as a patient. Having over a dozen nurses as direct relatives in my family, today's topic is very near and dear to me, especially since May is both Asian American, Native Hawaiian, Pacific Heritage Month and Mental Health Awareness Month. 2 things that I care very deeply about. So I really look forward to bringing my authentic self to this presentation and share how my research over the past 18 years has used community-based participatory research to create a culture of mental health in the Filipino community. In this presentation, I will be wearing all three of these hats as a pediatrician, a scientist, and a parent. Speaking of that, this is when I became a mother at Packard. And yes, you will probably recognize our very own Dr. Henry Lee, who I asked if he could be in the delivery room during my C-section with my firstborn. The objectives for today are listed here. I won't read them in the interest of time, but we will go over them, each of them. So we're going to start with describing the impact of colonialism and racism on Filipino health and mental health disparities. Filipinos are the third largest Asian subgroup and immigrant group in the US. Oops, let me go back there. Sorry, I went back too far. Okay. And they're actually the largest Asian subgroup in California. They make up the largest number of multiracial Asians in the US as well. Despite their size, they are underrepresented in health and mental health research. They've also been described as having educational downward mobility, which I'll describe in a few slides. AANHPI is number 22 million in the US, and Los Angeles and San Francisco are the US cities with the largest number of Filipinos. And as I mentioned, Filipinos are the third largest. When we look at the US mainland cities with the highest percentage of Filipinos, actually 1, 2, 3, 4, 5 of them are actually in the Bay Area. 30% of the population in Daly City is Filipino. And what you see here, South San Francisco is about 16%. US-born Filipinos are less likely to have a bachelor's degree than Filipino immigrants and other US-born Asians. This is using micro-level data at the US Census Bureau. Also, according to the Pew Research Center, educational attainment in the US varies by Asian subgroup. So you'll see here it ranges from as high as 43% among Indians to 5% for Latinos, and Filipinos fall around Vietnamese and African Americans at 10% for the percentage of those who have a graduate or professional degree. In a recent special health affairs issue on racism and health, Dr. Sabato Liwag and co-authors discussed the impact of colonialism and racism on Filipino American health disparities. They had 3 points. First of all, under the AANHPI umbrella, health determinants are often hidden within each subgroup. They also talk about, what does institutional or structural racism look like among Filipinos? And then end their article with multi-level strategies to focus on and invest in PhilAms. In terms of health disparities among PhilAms, because the data on Asian Americans remain aggregated, knowledge about PhilAm issues goes widely unnoticed. As a result, few are aware that PhilAms experience high rates of hypertension, type 2 diabetes. They lead incidence rates for breast and prostate cancer among Asian Americans. They also have mental health issues, which will be the focus of my talk, and also have limited access to both healthcare and mental health care. They also have less utilization due to stigma of mental health care. It's also important to understand the historical context related to PhilAm health disparities. The Philippines is actually the only Asian country that is a former US colony. As a result of nearly 500 years of Western colonization, including Spanish influence. The Filipino today, may embody Spanish cultural influences. Many of them are Catholic, including myself, and they are taught English in the Philippines and US history in Filipino schools. The presence of US military and educational systems over the past century has really influenced Filipinos' professional patterns and migration, including an upsurge in naval personnel, nurses, and engineers. As I mentioned, many of my relatives are nurses, and this kind of explains why there's so many of them. And engineers, my dad was an engineer and was part of the post-1965 migration, also called the brain drain from the Philippines. Also military brides, and all of these personnel, many immigrated to the US and beyond, all around the world. In addition, Filipinos have been described to have lower per capita income levels than other racial and ethnic groups, and they also experience higher levels of difficulty in translating former training into comparable occupations in the US. So despite these advantages, these health advantages of speaking English and having an American style education, these US immigration policies really were there to put in place to fill in labor shortages in the US. So what happens when we are able to collect Filipino specific data? Well, according to an article by Agnes Constante, Filipino Americans, have been hit hard by the COVID-19 pandemic, but the available data mask the impact. Fortunately, based on the advocacy of nursing labor organizations and Dr. Inez Ponce at UCLA, we are able to have a glimpse of what's been happening with the pandemic. So almost 1 in 4 Filipinos are frontline healthcare workers. And in California, PhilAms actually represent 20% of nurses. According to National Nurses United in the US, PhilAms make up 4% of registered nurses, yet they made up 32% of nurses who've died of COVID and 54% of nurses of color. And, when I see these numbers, I see faces. I see my aunts and I see my relatives and my cousins. According to Dr. Inez Ponce, Filipinos also, they make up 3% of the population in California, but they made up 31% of healthcare worker related deaths. When we look at mental health, we find that Filipinos have the highest rates of suicidal ideation in a very large school district. This is data from San Francisco Unified School District, looking at middle schoolers in 2017. They had more recent data in 2019, which showed similar statistics. All right, now we're going to jump into talking about protective and risk factors for suicidal behavior among Filipino youth. For suicide and AA and HPIs, it may be less linked to mental illness compared to the general population. And the literature shows that suicidal behavior may be precipitated by these issues here: academic, financial problems, family conflict, discrimination, racism, interpersonal shame, difficulty meeting personal, family expectations, and lower rates of help seeking. In addition, there can be trauma and a term called colonial mentality, which I'll describe in the next slide. So as I mentioned, the Philippines is unique in that there was 300 years of colonization by the Spanish and then 50 by the US. And there's a term coined by Dr. E.J. David called colonial mentality. And this is the belief that the cultural values of the colonizer are inherently superior to one's own. And there's 5 indicators of colonial mentality. The first being feeling inferior for being Filipino, feeling ashamed and embarrassed of being Filipino, being discriminated against, or discriminating against kind of like less westernized Filipinos, the ones who immigrate here later, desiring lighter skin and European physical traits, and kind of denying or minimizing the historical and modern day oppression of Filipinos. Just examples of colonial mentality can be growing up, we're told not to really go out in the sun too much and get too dark. In the Philippines, there's actually aisles in the groceries of skin whitening creams, kind of being told to do this to my nose daily when I was a child to make my nose kind of appear more pointier. So those are just examples. Another example is that we weren't really encouraged to learn Tagalog growing up. We were told by teachers to not necessarily teach us Tagalog so that we wouldn't have accents. And so in a sense, my family sacrificed their native tongue in order to assimilate here in the US. So studies have shown that colonial mentality has been transgenerational, and that higher levels of colonial mentality have been associated with poorer mental health outcomes, including depression, anxiety, lower self-esteem, and low life satisfaction. So how do we go about addressing suicidal behavior and mental health issues? Fortunately, during my training at Packard with Lisa Chamberlain and Fernando Mendoza, I learned about community-based participatory research. And as many of you know, it's where you begin with the community, asking them what their strengths are, what their needs are, and then together combining knowledge with action so that you can achieve social change and eliminate health disparities. In a sense, it's conducting research for us and by us. So we have a multidisciplinary team called the Filipino Family Health Initiative, made up of academic doctors, community docs, occupational therapists, psychologists, churches, schools, community-based organizations, health and mental health providers, just anyone who wants to be with us. We also have an advisory board of parents and grandparents who advise our work. And when we ask the community what can be done to address these mental health disparities, their answer was to build on the strengths that already exist in the PhilAm community by, number 1, improving parent-child bonds, 2, reducing stigma, and also 3, connecting loved ones to mental health resources and providers. I'm going to focus on the first one, improving parent-child bonds. So in my first study as faculty at CHLA, we did a needs assessment where we asked the community, what are the mental health needs of Filipino Americans here in the LA historic Filipino town area, and what can we do to prevent them? And their answer was to provide parenting support. And it was actually a Filipino psychiatrist in the community who recommended a program called Incredible Years. And we ended up implementing this program, and today it's been in implementation for over a decade. And these are the outcomes that Incredible Years acts upon: increases parental praise, better problem solving and family communication, and it also has decreased parenting stress and depression and criticism, negative commands, and physical punishment. And Incredible Years is kind of like a vaccination, as my colleague Dr. Coffey says, against future behavioral health issues. And long-term studies have shown that its effects are sustained even 12 years later. And so we have been conducting a randomized controlled trial of the Incredible Years program as part of the Filipino Family Health Initiative. We have switched it to go virtually during the pandemic, and that enabled us to move it from just specifically in LA in person to statewide in California. And I'm also pleased to announce that we are going to be offering it soon virtually this summer in the Philippines, and it's now going to be open up to the rest of the US. And so listed here are the 12 workshops that we do. We meet with families 2 hours a week, and we show videos of, less effective and more effective parent-child interactions. We actually have the parents act like they're the children, and they practice, which they have a lot of fun with, and we also assign them homework. So what does Incredible Years do to prevent teen suicide? So it really enhances the suicide protective factors that I mentioned earlier. So trying to promote family connectedness, increase other adult caring, other caregivers such as grandparents who might be involved, trying to also kind of change the way they approach promoting positive behavior among children. It also tries to promote positive cultural values, regardless of which background you're in. The Incredible Years has been implemented internationally, and it's been shown that it treats parents as experts in their children and really, really encourages them to discuss and promote their cultural values and do kind of special time activities based on your culture. And the specific cultural values that we found helpful in our groups is kapwa, which means shared identity. Parents feel like they're not alone when they hear other Filipino parents also struggling with parenting. And then the other cultural value is bayanihan, and bayanihan is another word for communal spirit, doing things for each other without expecting anything in return. And here is a picture of community in the Philippines. Often the houses are on stilts, and so when they need to move the house, the whole town comes and helps move the house for you. So I wanted to share a little bit about our preliminary results from our current randomized control trial of offering these virtual parenting workshops during COVID. Our objective was to test the efficacy of the Incredible Years School Age program among Filipino parents of ages 8 to 12 in California. And in this pilot study, so far, we've recruited almost 50 parents, and we've had a 20% retention rate. And each parent was randomized to either intervention versus their 3-month waitlist control. And the outcomes that we looked at were parenting practices, child behavior using the child behavior checklist, the SCARED, which is a measure of anxiety, the child depression inventory, and parenting stress. We also measured other things like demographics and enculturation, a measure developed by Dr. Alicia Del Prado. So far, 18 parents have completed the Incredible Years, and once they're in, they really like the program, and we found that our median attendance has been 11 out of the 12 workshops. And right now we have 21 who are in the control group who are waiting to do the program. So here are some of our results. In the dashed line is the control group, and in the solid line is the intervention group. And when we look at the parenting practices inventory, we found that the intervention group had significant increases, or statistically significant increases, in the use of praise and incentives such as behavior charts. We also found that parents in the intervention group were less likely to report that their child had internalizing behaviors, such as anxiety symptoms and depressive symptoms, compared to the control group. And then these tables talk about the measure of using the SCARED to measure anxiety. And what we found was, I'll start on the graph on the right, that there weren't any significant differences in the parent report of anxiety. So in this instance, the intervention group did show a trend of it going downwards, but it was not significant. However, when we asked the children to rate or to fill out the scared and talk about their anxiety symptoms, we do see a significant decrease in their symptoms of anxiety. And this just goes to show that you can have this multi-generational approach to mental health promotion and prevention. So by acting upon the parents, we can affect the child's behavior, even though the parent's perception might not be the same at the time. And finally, we're going to talk about, ways pediatricians can address mental health among Asian American, Native Hawaiian, and Pacific Islander youth and families. And I'm going to start kind of more like on a macro level broadly when talking about this, but then we will end with more kind of practical things that we can do to help AA and NHPI youth. All right. So our team was fortunate in being funded in the inaugural cohort of the Robert Wood Johnson Foundation Clinical Scholars program. And this was a leadership fellowship where we were given like leadership coaching, but also given funding to work on what they call a wicked problem. And so our wicked problem was to kind of prevent our depression and suicide in the Filipino American community. And what we did was we took the culture of health framework devised by the Robert Wood Johnson Foundation, and we operationalized it to our work. So I'm going to just kind of walk through this. So in the culture of health framework, there's two phases, phase 1 and phase 2. And these diamonds here are the 4 kind of pillars of how to create a culture of health. So the first step is to make health a shared value. The second step is to foster cross-sector collaboration. And so, not only stay in medicine and primary care, but partner, for instance, with education, churches, behavioral health, childcare. And then number 3 is to transform healthcare systems. And so that means, again, like working across these silos to really try to promote health equity. And finally, figure out how to strengthen the integration of health services and systems. And a great example of that is how do you co-locate things like parenting interventions in primary care settings. So what we did in our project is that we made health a shared value by creating a culture of mental health. And this was done by conducting a study in which we conducted focus groups with Filipinos to see, what is your definition of emotional well-being for adolescents, which I'll talk about in the next few slides. We also had a wellness conference focused on decreasing mental health stigma, which I'll also discuss. And in terms of phase 2, we used our research to advocate with the LA County Department of Mental Health and advocate for them to add incredible years as a billable preventive intervention. And this is really critical because, as everyone knows, once research funding ends, we're always struggling with like, how do we make these programs sustainable? So this has enabled us to continue to offer incredible years even after research funding ends. And it not only benefits the Filipino community, but all communities in Los Angeles currently, since anybody who's using IY can bill it as an intervention, a preventive intervention. I also mentioned that we've tried to connect primary care to behavioral health interventions. I work in a federally qualified health center called Altamed, and we are offering incredible years there. Kaiser Los Angeles is also a site for our current study, so we're trying to work with them as well. We also have trained providers, mental health, primary care, also parents and grandparents to become incredible years group parent leaders, many of whom are Tagalog speaking as well. And as I mentioned, we are conducting an RCT evaluating the parenting programs. And so these are just some of the outcomes during our 3-year funding from the Robert Wood Johnson Foundation. We were able to do many, many presentations. This is all pre-COVID, have additional community partners, engage 15 of our community advisory board members, pilot the Incredible Years group, train 45 individuals. And when we ended in 2009, this is what our numbers were. And then we are also able to get additional funding to continue the work. So how did we make mental health a shared value? So, using CBPR, we sought to really address these mental health disparities among Filipino youth by creating this shared definition. And the hope was that this might reduce barriers associated with Filipinos' access to healthcare resources for their children and families. We conducted 5 focus groups with Filipino American adults, parents, and community stakeholders to develop this shared definition. We used Wordles, which I'll show you, to generate visual representations of parents' thoughts about mental health. And we also presented 5 widely accepted definitions of child and adolescent mental health to stimulate thinking and discussion. We use grounded theory and coding consensus, co-occurrence and comparison, as well as narrative and content analysis for explicit theory construction. What was also unique about this study was our use of indigenous research validation method from Psikologiyang Filipino. And this is reflected by participants' use of like strength of kapwa, which is shared identity, and also ibang tao, which is outsider, and di ibang tao, which is one of us continuum. And the background on Psikologiyang Filipino was that it was developed in the Philippines to decolonize the conceptualization and practice of psychology in the Philippines. It's very strengths-based as opposed to deficit-based, which is in line with CBPR. So for the demographics of this study, 62% were female, 84% had a college degree or higher, and the age range was from young adult to up to 79 years old. And the majority of the folks who did our study were born in the Philippines. And so when we first started the focus groups, we actually had a paper easel board and Post-it notes, and we had the question, what words come to mind when you hear the words mental health in the Filipino community? And the words that were said more are larger compared to the words that are smaller. And you can see here, there's a lot of kind of negative words like judgmental, shame, crazy. There's also the word family, and family can be both a source of stress, but also a source of strength. So I think that's really critical that family is so connected to what people think of when they hear the words mental health in our community. Then we asked parents to think about like, what words come to mind when you think about child and adolescent mental health? And the words that came to mind were well-being, peace of mind, having a sense of identity, coping with normal stressors, being productive, having effective coping skills, contributing to the community. And as a mother of 2 teenagers, I see the importance of wanting all of these things for our teens. And so as a result, this is the shared definition that this research came up with. So mental health or peace of mind is a sense of acceptance and balance that comes from having a strong system of friendship and sound family relationships that allows adolescents to be the best they can be. It's a compassionate community, like a family of extended family, a source of help where making simple connections with others leads to open communication within families, friends, and community. Understanding the Philam experience in terms of generational, cultural, and immigration level differences, as well as understanding how colonial mentality is still affecting Philippine Americans now. This promotes a sense of identity and self-worth within Filipino American adolescents. I'm pleased to mention that this article was published in the inaugural special issue of the Asian American Journal of Psychology. This special issue was called The Growth of Filipino American Psychology, led by guest editors Dr. E.J. David, Kevin Nadal, and Dr. Del Prado. So in addition to creating or making mental health a shared value, I mentioned we had a conference to really try to destigmatize mental health. And this was just not, pediatric providers. We really wanted to present the best science, but also cultural dance, storytelling from parents, including a mother who is a nurse of a young woman who had taken her life and the life of her baby as a result of postpartum depression, a mother with child with autism, and a mother who is a single parent and raising her kids on her own. So this was a very kind of multidisciplinary community conversation that we had. And this is a picture from that day where we had, as I mentioned, cultural dance and many speakers. And we did do an evaluation at the end, and there was a spot to write in open-ended comments. And this is a comment from one of the participants who came to this community conversation. We can no longer afford to be a silent minority because too many of our youth are dying. So moving along with the Culture of Health Action Framework, we also are breaking down silos, so breaking walls. And these are just some of our community partners that we have had during this past decade. We are also, continuing to offer evidence-based parenting programs to families. I mentioned that we've, worked with the LA County Department of Mental Health to get it approved as an intervention. We've also moved from offering incredible years to school-age families, to parents of school-age families, to also the younger. So we offer the preschool program in English and Spanish. And this summer we'll be offering it to toddlers as well. We've been offering for a few years now the Incredible Years Parent and Baby program in both English and Spanish. I have a current General Academic Peds Fellow or Health Equity Fellow, Dr. Karen Camara, who's been leading the groups in Spanish. So that has been particularly rewarding, especially during COVID, where new moms have often been very, very isolated. I think my last English speaking group that we led, there was a Latino mom, an African-American mom, and a Filipino mom all in one group. And they just, had that shared identity of new moms and the love for their infants. And so that was really rewarding to see. Our most recent group, many of the moms were mothers of children with special needs, and but mixed with other moms with healthy children. And it was just nice to see them also kind of bond with each other, even though it was just online. I mentioned that we've been able to expand statewide from Southern California to the rest of the state. And these are some of our newer partners since COVID has begun, including Little Manila Rising from Stockton, Galing Bata in San Francisco and Soma, SFUSD, the Bulosan Center at UC Davis, and other international organizations as well. Something that also has come up is the rise in anti-Asian hate, and much of the attention has been on the impact on elderly members of our community and women, but I also want to just shine a light that it's also affecting the youth. According to the recent Surgeon General on Mental Health, Asian American, Native Hawaiian, Pacific Islander youth, they are at higher risk for emotional distress due to hate and harassment. According to the Stop AAPI Hate website, 16% of all self-reported hate incidents were by youth. Half of them were reported in California, and girls were 2.5 times more likely to report hate incidents, which is slightly higher than the adult ratio. Youth were more likely to be harassed at school, public parks, and online. And this kind of highlights the need to kind of incorporate conversations between parents and youth about anti-Asian racism. And actually, this actually just came up during our groups during the time that it was happening. And we did talk a lot about it during our workshops, and we continue to do so currently. The types of discrimination that are affecting youth are most commonly verbal harassment and name calling, shunning, and more rarely physical assault, but also online. And in these instances where it happened, half of the incidents actually had an adult who was present, but only 10% of the cases did those bystanders intervene. So a lot of AAPI organizations have been having bystander trainings to give communities the skills to intervene safely. In my roles at the Pediatric Policy Council, and I'm also on the advocacy chair for the Society for Pediatric Research, was able to provide some feedback on this statement on anti-Asian hate that was written by FOPO, the Federation of Pediatric Organizations. And their statement is that hate directed at one member of our community threatens all members. Pediatricians across the country care for millions of AA and HPI children and families, and 16% of hate crimes have been reported by the youth. And this is concerning given the links between racism and poor mental health outcomes. It's also important to note that nearly 1 in 5 pediatricians is Asian American. And as one of them, it was just very impactful to see this statement. Other ways to promote mental health include cultural pride reinforcement. It's important to help youth feel proud of their ethnicity and proud of their ethnic identity. We know from research that leads to better mental health outcomes. And so these are just examples of recent ways we can celebrate in our community. Growing up, we did not have Filipino American History Month, so this is a new thing for me. October is when it's designated, and these are just examples of ways that you can remind our youth that Filipino Americans are, an important part of this nation. And this is part of the statement by President Joe Biden that he made during Philam History Month. I really love the end of it where he talks about, we come together as one nation to honor the history and service and sacrifice of the Filipino American community and welcome the future achievements of their youth. Another way we've been able to promote ethnic identity is to be involved with the Filipino Women's Network. This is a global international organization whose goal is to have a Filipina leader in every sector across the globe. Was humbled to be able to attend their conference, and it was amazing because it was the first time where everyone at a conference looked like me. And the quote that I remember seeing when I visited was, "I do not wish women to have power over men, but over themselves." And so had the ability to bring my own children. I'm wearing a traditional Filipino dress, and we are wearing it here as well. And they have come out with me also in the community doing outreach as part of the Filipino Family Health Initiative. It was very meaningful as a leader and a mother to model for your own daughters and the next generation, and blessed to have that opportunity. Other ways to kind of promote cultural pride are to share with your children the President Biden statement on AANHPI Heritage Month. And also, I've had the opportunity to work with 300 Philam scholars on a project called the Encyclopedia of Philam American Studies. Growing up, I had an encyclopedia in our house, and I remember, always looking for things about the Philippines in it. And so I was asked to be the editor for the health section of it, and that'll be coming out in the fall. All right, so I do want to switch gears and talk about, what we can do now to really help this mental health crisis. I don't need to remind you in the audience that teens in distress are swamping pediatricians. One of my colleagues yesterday mentioned that in clinic, that it's taking time. It's not something we can rush when we're trying to help with the mental health of our youth. Also, we're seeing hundreds of suicidal teens sleep in emergency rooms every night. That's also something that we're trying to figure out how to address. For Asian American, Native Hawaiian, Pacific Islander youth, ages 12 to 19, this is especially critical because suicide is the leading cause of death for this age group. So what I've learned is that if you want to go fast, you can go alone, but if you want to go far, you need to go together. And so in the next few slides, what I'm going to share with you is practical advice. I went to my community, this is our collective voice, and I asked them, if you had 3 things that you wanted to tell pediatricians about AANHPI mental health, what would they be? We asked youth, young adults, parents, mental health providers, occupational therapists, scholars, and let me go over them by group. So what did the youth say? The youth shared that stigma around mental health mainly comes from adults in their lives. They have been described as being dramatic, you're exaggerating things, you're doing it to get attention. They feel that their problems are minimized. They're told that you're crazy for thinking or feeling a certain way. And another message they hear is that mental illness is the fault of the individual and that it's their fault. I have the pleasure of having many pre-med and undergraduate and graduate interns who help with the Filipino Family Health Initiative, and this was their collective answer. They wanted pediatricians to show parents that mental health is just as important as physical health at their kids' annual physicals. They recommended to create a safe and open space for dialogue about mental health and provide cultural empathy, involve parents and youth in these conversations, as well as acknowledge the acculturation gap that happens among AANHPIs. They also wanted us to be cognizant of the rave culture and the use of Adderall during college to be able to study and get through college, and also wanted more research on the model minority myth on seeking mental health services. As for AA and HPI providers, they recommended to have storybooks that embrace DEI topics for the AA and HPI community. An example of a storybook is here, the story of Patsy Mink, the first woman of color elected to Congress who wanted to be a doctor, but because she was a woman, was rejected. Instead, she spearheaded and fought for Title IX and won. And this is someone I didn't learn about until my fourth grade daughter wanted to know, who should I write about for Women's History Month? And we discovered her together. Providers also want us to understand microaggressions that affect Asian children, but also those that affect multiracial children. Review our paperwork where parents fill out to make sure that does not perpetuate microaggressions. And also understanding that youth might not feel comfortable to talk to their adult family members about problems. Also, AA and HPA parents might not know how to approach how to talk about anti-Asian hate and discrimination. So things like the Incredible Years can be helpful. They also talked about, families may not be inclined to disclose mental health concerns because of shame and not being open to talk to and be open to with strangers. Eating disorders may also be something that may be more common as well. They also recommended to have representation of the AA and HPI workforce, especially with language capacity. Disaggregation is important. Social media should be talked about. It's not all good, but it's not all bad. Listening without judgment, and relationship is more important than performance, and it's common and nothing to be ashamed of. Please get help. Another provider shared that because someone looks okay doesn't mean they are. Try to avoid words like you should or just do or try it, or a way that this person approaches talking to youth is to say that, I know you aren't lazy. I see you as being burnt out because it takes so much energy to do your best with all you're going through. And sometimes that's the first time that this teen may have been listened to. And oftentimes this provider found that the teen starts crying when and opens up with her. Also talking about how therapy is like having a life coach, where you're getting the process of strengthening your coping skills. And it's important to normalize so that they don't feel alone, but don't minimize. We also asked mothers, what you would want pediatricians to know. They said that Phil-Am youth have unique pressures such as family, religion, and Filipino values that may prevent them from seeking help in fear of looking weak or look like they are complaining. They wanted our milestone handouts to also talk about growth mindset and the importance of spending time with their kids. And they would love for pediatricians to model open communication about mental health during checkups. Another mom shared that you need to step back and let your kid verbalize their feelings and just listen, praise the positive, and compliment. I see this mirrored in my kids' relationships with their peers. And last, a father shared, as tired and busy parents can be, just spending as little as 10 minutes with them, hearing and listening to how their day went and their silly stories makes a big difference. Those little moments give them big memories and happy memories. So I just wanted to end, on a positive note and just emphasize these positive childhood experiences that each of us as pediatricians and anyone in the community can help promote in our children. These are 7 things that if children have, they're more likely to have better mental health and lower risk of depression and healthier relationships in adulthood. So the next time you need a reminder on how to plant the seeds of the future, think of these positive childhood experiences. As pediatricians, I think it's our responsibility to engage in prevention, especially for AA and HPI youth, who even before the pandemic, suicide was already the leading cause of death. And as my community partner shared, COVID made an already bad situation worse. So thank you everyone for your attention, and just final kind of thank you slides to the people who have brought me here. I'm on the shoulder of giants, my team, our interns, and the families and parents who've participated in our workshops, and of course, my own family. All right, so I'm happy to answer any questions. I'll stop sharing in a second, but before I do want to kind of share an event that is happening focused on speaking up about anti-Asian hate, which is called the Vagina Monologues, where it's going to be an all Asian cast. All right, I will stop sharing.
Thank you so much, Dr. Javier. And so our first question is, do you have resources or advice for Filipino youth and teens who are learning more about their cultures and might want to have more open conversations about current events with their families, but might have different opinions with elders, for example, about politics or the recent PI election that might create a larger parent or child divide?
Yes, I think that's an excellent question. I'm not sure how I put things in the chat. Oh, here. Okay. So we have a website called filipinofamilyhealth.com, and that has actually a resource guide that talks about programs in your area. Our lovely intern, Jessica Castro, put that together and does have resources both regionally and in different parts of the country where there are many Filipino Americans. But that is a tricky issue when there's differences in family about politics. And I think with anything, we need to kind of come to an agreement to disagree often, and respect that, a person that you love may have different political values as you, and we just have to kind of try to move forward with that. So thank you for that question, and I can empathize with your concern.
One of the other questions, just lots of gratitude for a great presentation. But one question was, what factors contribute to the 20% retention rate of the program? And then if you have any advice for increasing retention, especially for doing research in the Philam community.
Yes, thank you for that question. I think that obviously we provide gift cards for parents' time to do these workshops through our community partnerships. We often are outreaching during events that are already happening in the community. So that's a great way to promote retention. With COVID, there's been just so much barriers for a lot of families. So the fact that we don't have to meet in person anymore to do the survey, we schedule anytime that they're available. So I'm grateful for my interns. They work on the weekends and the evenings when Filipino families are not working. We offer our workshops on Saturdays. We're still trying to preserve Sunday, but most likely we'll offer them Saturday afternoons. We offer them when people are not working to kind of meet communities where they're at.
Thank you so much. And I see that we're at time. And so several people complimented your presentation. And someone said that they're just awestruck and so excited to see your professional advocacy work has continued to grow. So I think with that is a great way to conclude.
Thank you so much.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.